During your newborn's first week, the desire to eat will reign supreme. Your little one will probably nurse every 2 to 3 hours, although formula-fed babies may last a bit longer between feedings. In fact, infants have what's known as the rooting reflex, which encourages your baby to open up and suck when faced with a breast or bottle. And your baby will be eager to do so, since newborns have highly developed senses of taste, and even at such a young age, can differentiate between sweet and bitter. Although your baby is eating often, your newborn will still lose up to 10% of his weight during this first week, as he sheds the extra water weight he was born with. In addition, your baby digests food quickly, so expect as many as 8 to 12 bowel movements a day and 5 to 6 wet diapers. And when your baby's not busy nursing or pooping, he or she is probably sleeping. Most infants will sleep 14 to 18 hours in a 24-hour time frame, although that's usually broken into several-hour intervals. During your infant's first week, your baby may also look a bit strange to you, and that's okay. After being curled in mom's tummy, most newborns stay scrunched up for a while, with arms and legs that may look bow-legged and bent. You'll also notice that when startled, your baby arches his back and extends his arms and legs, a habit known as the Moro reflex. Because of these natural reactions, your newborn may be most comfortable swaddled snugly in a blanket at first. There are more developments to watch in the coming weeks, so stay tuned. Your baby was born nearsighted, and even though eyesight is still fuzzy, he or she can see you in detail when you're 8 to 10 inches away. And studies show that newborns prefer human faces to all other patterns or objects, so give your baby plenty of face time. Help your baby develop those eye muscles by slowly moving your head back and forth or bringing objects close to him, then moving them away again. And at this point, your baby can even recognize your gestures and faces, so play by raising your eyebrows or smiling. Many 1-week-olds will even respond in kind. Don't worry if your little one looks at you with crossed eyes. It's often a part of normal development. Although your baby is busy learning, this second week of life will still center on sleeping and eating. If your infant is indeed eating enough, he'll pass frequent mustard yellow or dark stools and will wet up to about 7 diapers daily. All that eating will also ensure that your baby gets back up to her birth weight, or beyond, this week. And while your newborn sleeps, you'll want to keep your baby on his or her back to help reduce the likelihood of sudden infant death syndrome, or SIDS. When your baby's awake, though, encourage your newborn to spend time on his tummy, which will help him learn to hold his head up. What a week, huh? Stay tuned for all that's to come in your infant's third one. Of course, in reality, your baby's belly button is firmly attached. But the umbilical cord stump isn't, and it will usually fall off at some point 10 days after your baby is born. Once this happens, you'll be able to see if your baby has an innie or an outie belly button, and you'll also be able to start tub baths. Other than the belly button's debut, your baby's third week will still focus mainly around eating and sleeping. And while your baby is becoming an old pro at both, you'll likely notice an additional skill, and that's crying. Because your baby doesn't have another way to communicate yet, this is how your newborn tells you that he or she is hungry, sleepy, sick, dirty, uncomfortable, or just in need of some cuddling. Most parents learn pretty quickly how to respond to their infant's cries, but sometimes comforting a baby isn't that easy. Up to 25% of newborns will experience colic, which is a fancy word for incessant crying that lasts for up to 3 hours, at least 3 days a week. Because doctors don't know exactly what causes colic, no medical treatments are currently available, but several things have been found to help colicky babies. Babies are comforted by gentle motion of all kinds, so invest in a rocker, baby swing, or simple bouncer. Your baby might also find it soothing to be walked around the house in a front pack or sling. And many parents find that a ride in the car, with its movement, noise, and vibration, is the best remedy for colic. It's important to note that what works for one baby won't necessarily work for another, so experiment and find out. If your infant is otherwise healthy and attended to, colic is generally not a cause for concern, and tends to ease by your baby's third month. Whether your baby is colicky or not, make lots of time to snuggle, rock, and caress your infant. Your 3-week-old knows you by now, and there's nothing more comforting to your baby than the sound and feel of you. It's true. By the end of the first month, most babies will start to aim smiles directly at you. And at this point in development, your baby may even use those new neck and shoulder muscles to lift his or her head briefly. Encourage your baby to do so by letting your newborn rest on his or her tummy when awake and putting your face in front of her. Or roll a receiving blanket into a log and place it under your baby's chest to help her push up. And when your newborn's not playing with you, your baby will probably be eating voraciously this week. That's normal, since this is one of your baby's first growth spurts, and your newborn may have gained an entire pound by month's end. You may have noticed that even when your baby isn't nursing, your infant is making sucking motions with his mouth. If you try to feed and there's no interest, your baby may just be looking for soothing. Offer a pacifier to help. And don't be surprised if your baby uses her own thumb or fingers to self-soothe. Remember that you should make an appointment for your baby's checkup with your pediatrician by the end of this month. This will allow your doctor to affirm what you already know, that your baby is doing a great job of growing.
When parents come for their 1-month visit, they're most interested in feeding issues, peeing issues, and pooping issues. Those are all the popular 1-month visit issues. So a 1 month should be feeding every 3 to 4 hours during the day. In the evening, a 1-month-old might feed every 3 hours, but they might sleep 3 to 5 hours, and if they do, then you're really lucky. You don't have to wake a 1-month-old baby up every 3 hours to feed anymore, unless your doctor tells you that your baby is not gaining enough weight and needs to be woken up every 2 to 3 hours, let's say. Breastfed babies wake more often because they just don't get as much volume when they breastfeed. Often, a baby's put on the breast, and when they hear the mom's heartbeat and they feel the mom's warmth, they just fall right back to sleep, and they don't finish that full feed like a bottle-fed baby might get 3 or 4 ounces before bed. Babies often cluster feed, and that's normal. So a baby might feed every hour during the day, especially a breastfed baby, and then in the evening, that baby might sleep longer, and that's fine. Babies should have anywhere between 3 to 5 wet diapers a day, and poop can range. Some breastfed babies poop with every feed, whereas some babies don't poop for 5 days, and that's totally normal. And I would say the majority of the phone calls I get are parents worried about a baby being constipated, and there's a wide range of normal, and that's okay. At 1 month, the baby should be regarding your face, looking at you while they're feeding, and what the baby is seeing is actually the contrast of you against the wall behind. So sometimes parents feel that the baby's looking past them because their vision is about 2400, it's very out of focus. So what they're looking at is a contrast of you against the wall behind them, and that's okay. Between 1 month and 3 months, a baby's gonna start to recognize you, regard your face, know your voice. A baby should be responding to sound, of course. They still have the startle reflex, so if a loud car drives by or somebody honks a horn, they'll startle, and that's a Moreau reflex, that's normal. A baby should be sleeping on their back. I recommend that parents rotate the baby's head from side to side. I almost make the analogy of a rotisserie chicken. You want it cooked all the way around. So with the baby's head, because we are preventing SIDS by having a baby lie on their back, we're creating a flat back of their head. So that's called postural plagiocephaly. To prevent postural plagiocephaly, I recommend that the parents rotate the baby's head from side to side when they put them to sleep. And then during the daytime, when the baby's awake, you can give the baby tummy time. So parents ask, how much tummy time does a baby need? And there's no set menu for tummy time. 5 minutes for a baby is eternity. So you often put your baby on their tummy and they're supposed to lift their heads up, but they smush their heads back down, and that's fine. But you want to keep on practicing with the baby because they're sleeping on their backs for so long. Some of their milestones are delayed, and we want them to learn to push up when they're awake. So whenever the baby's awake, you can put the baby on a firm surface, like the mattress in a crib or a play mat on the floor, and let the baby learn to push up and hold their head up. Babies don't need water at this age. Water starts at 4 months. So on warm days, you just have to keep your baby cool and well hydrated with formula or with breast milk. As far as smiling develops between 6 weeks to about 2.5 months, and a baby will start smiling when they're happy or when they're soothed. A baby should also, between 1 and 3 months, be calmed by your voice when you come in the room and consoled. If a baby has excessive crying where they cannot be consoled whatsoever, then you should contact your physician.
You've already celebrated your baby's first steps, but keep that baby book out. During the next 4 years, you'll cheer on your child through many more milestones. 2-year-olds may show signs they're ready to be potty trained, but don't force it. Some kids aren't ready yet. Start saying no and being defiant. What you may see as the terrible twos is a positive sign of increasing independence. Learn more words. They may know 50 or more, and start interacting more with other children. 3-year-olds are increasingly social. They may show fondness for playmates, even mimicking them. They may also know their own first name and age and identify their gender. Play make-believe. Draw and feed themselves. 3-year-olds can handle crayons and use forks and spoons. At 4 years old, preschoolers are very enthusiastic about new things. They learn to sing songs and nursery rhymes, to throw and catch balls more accurately, to use the past tense. What's more, they may know more than 1,000 words. And they may curse. If they hear you swearing, chances are it will come right back at you. So try not to do it, and do your best not to overreact if it happens. A big reaction from you is a reward to your child. At 5, your child is probably ready to start school. Besides this major milestone, kids this age follow rules. Unlike 4-year-olds, 5-year-olds are very eager to please parents and authority figures. Understand the concept of time. They get it that there's a school time, a dinner time, and a bedtime. Somersault. A 5-year-old has growing physical skills and can swing and tumble by themselves. Some 5-year-olds may even be ready to bike and jump rope. Children change a lot between the ages of 2 and 5, but each one is unique, and if your child doesn't hit every milestone at the average age, don't fret. If you do have concerns, however, talk to your pediatrician. Early intervention can often eliminate or reduce any actual issues. A parent always worries that their child will be handicapped in some way. While you may not be able to identify a specific disability or disorder, you can look out for signs of delays and talk to your child's pediatrician about them. A major sign of a developmental disorder is the loss of skills or traits your child once had. For example, if your daughter used to be very affectionate and talkative and is now quiet and distant. Intellectual disabilities or disorders may exist if a toddler seems to be significantly behind her peers in reaching almost all cognitive, emotional, and social milestones. But there is a great deal of variance here, as children regularly develop at very different rates. You should bring your 2-year-old to the doctor for a screening if she can't speak in sentences of 2 words or more, doesn't know at least 15 words, can't imitate simple actions like clapping hands, doesn't know how to push a toy truck, doesn't know the function of everyday objects like a stove, doesn't respond to the sound of your voice, and doesn't cuddle with you. Signs of developmental delays in 3 to 5-year-olds include lack of make-believe games, trouble solving simple problems such as putting a round peg into a round hole, difficulty playing with simple toys, lack of eye contact, trouble going up and down stairs, inability to follow 3-step commands such as go to the kitchen, get an apple, and bring it to me, absence of interest in other children, lack of a wide range of emotions, inability to use plurals, past tense, or their first or last name. Every child grows at her own pace. Your pediatrician may find that yours is healthy, just progressing slower than her peers. Ask your pediatrician for tips on encouraging development. Children who do have intellectual disabilities will benefit from early detection and therapy. So that trip to the pediatrician is definitely worth it.
The Bahamas Neurological Center, established since 1999, the only facility in the Bahamas that offers comprehensive neurological, neurodiagnostic, and neurorehabilitation services at the one local. The first comprehensive neurological clinic in the Bahamas. The only multidisciplinary facility in the Bahamas catering to the English-speaking Caribbean. Our main mission is to provide our local and worldwide customers with qualified medical providers and administrators who can deliver world-class standards of service and products within the Bahamas and Caribbean region while promoting our customers' good health and overall well-being. Rehabilitation services. We utilize an interdisciplinary approach to the management of clients with neurological disorders. Our neuro rehab team comprises of neurologists, nurses, clinical psychologists, physical therapists, and occupational therapists. We treat children and adults with disorders such as cerebral palsy, brachial plexus injuries, developmental delays, learning disorders, attention deficit disorder, autism, epilepsy, spinal cord injuries, Alzheimer's disease, orthopedic injuries, and Parkinson's disease. Physical therapy. Our physiotherapist provides comprehensive assessments and treatment of musculoskeletal injuries. A strong emphasis is placed on active rehabilitation programs which return clients quickly and safely to their pre-injury condition. Each treatment course is specifically designed to meet the individual requirements of each client. Physical therapy treatment options. Some of our options are physical assessments and treatment plans, soft tissue manipulation, joint mobilization, electrical stimulation and microinferential current, therapeutic ultrasound, ergonomic analysis, and patient and caregiver education sessions. Occupational therapy. The goal of our occupational therapist is to help our patients achieve the best optimal function in all aspects of their life, including work and self-care. With the help of our occupational therapists, our patients are able to gain personal independence to help them reintegrate into their environment, for example, work, school, etc. Evaluations. Some of our evaluations are cognitive performance, instrumental activities of daily living, customized treatment plans, cognitive remediation, development of fine motor skills, and recommendation for assistive devices and home modifications. Psychology. The overall goal of the clinical psychologist is to reduce any psychological distress and promote the emotional well-being and overall development of children, parents, adults, and families. The focus is on the patient's behavioral, emotional, and social functioning. Therapy. Some of the areas we deal with are cognitive behavior therapy, depression, anxiety, behavioral modification and management, general counseling, both grief and coping, developmental delays and special needs, and stress management.